So maybe you could speak a bit to how the skeletal muscle mass really matters for longevity of the patient.
Sure. Yeah. And I was going to say, at no time is that more prevalent than sort of that middle age, right? Where people may say their weight's creeping up a little bit, but more often you're hearing people say, my weight's the same, but I feel different and I'm feeling more of that weight in my midsection, usually is what we hear. And so, even though the weight might be the same, we're seeing that shift, right? More central adiposity, more visceral fat, and less skeletal muscle. And so one of the big reasons that skeletal muscle is so important is that it helps us with mobility. And as we age each year and each decade, we are losing a little bit of that skeletal muscle if we're not doing some of the, intense things to protect it by, paying attention to our diet and nutrition and focusing on protein intake, as well as, doing some strength and resistance training and focusing on movement. If we're not doing that, we're going to see a slow decline. And so that's something that from a functional perspective and aging and frailty and falls, there's a lot of risk associated with that over time, that sarcopenia or sarcopenic obesity, even where maybe muscle mass is low and body fat is high. We're seeing that be associated with other health conditions and risk. But even further, it's related to a lot of the other metabolic processes in the body. And so some of the cellular level that's important, metabolic level with diabetes and some of the other conditions there with your liver, and all of these areas are impacted by having good skeletal muscle on our frame. And so it helps also with, just as the body burns calories, the more fat-free mass we have, the better we are at being more efficient calorie burning machines. And so something you can look at when people are losing weight is what's happening to their resting metabolic rate. And often when you're losing weight, that number's going down. But as someone's increasing their fat-free mass or their muscle mass, that's a really important way to keep that resting metabolic rate up. And the higher that is, the more calories you're going to be able to consume and stay at that same weight or lose if that's the goal. And so there's a big component of sort of the metabolically active tissue of that muscle tissue that really helps us as we're trying to sort of manage weight and stabilize and sort of recomposition through middle or older age as well.
Right. And of course, skeletal muscle is such a great sink for blood sugar that it can really help our patients who have glucose issues as well. And also just to be able to perform all those activities of daily living that we would like to be able to do into our older years. It's really critical to maintain that skeletal muscle mass. Some studies have stated that it's probably about 1% that you're going to lose every single decade, if not more. So you're working against the clock. And if you are also decreasing your adiposity, taking off fat mass, given that the body has less mass to move around, the skeletal muscle mass decreases on its own that way too, which is kind of the double-edged sword of weight loss in a way. And that, of course, is going to affect the resting metabolic rate, as you mentioned. If you have less skeletal muscle, you're going to have a lower resting metabolic rate.